welcome back to another episode of Nursing with Ingrid. Thank you for stopping by yet once again. And I'd just like to say at this point, welcome to all the new subscribers that have joined this channel. I truly appreciate you. And welcome back to the old subscribers, the OGs that have been with me since day one. I haven't been around, that is obvious. But that is due to a multitude of reasons and not excuses. However, I'm back at the moment and I'm here today to speak to you with regards to when you get admitted as a patient. Right off the bat, you need to understand that when you are going to be admitted for a procedure, whether it's an elective procedure or whether you're being admitted for diagnostic reasons, there's a lot of things that go into play with regards to how smooth your hospital stay will be or how many difficulties you will encounter during your stay in hospital. The first thing you need to look at is to make sure that the surgeon that is looking after you or the doctor or the primary physician that is looking after you has your best interests at heart. What do I mean by that? I mean that your doctor that you have consulted with or have been referred to has your best interests in heart with regards to your finances, with regards to your health, and with regards to your well-being. That is very important because at the end of the day, you don't want to go into hospital and into theater not knowing exactly what the complications are. You don't know exactly what to expect when you wake up. You don't know how long you're going to be in hospital. What are the preparations that you need to take care of before being admitted, as well as how to look after yourself after you have been discharged from hospital. So here are a few tips that I have for you that may help you with regards to your stay in hospital and your admission process. The first thing you need to know is that your physician, his name, his qualifications, and his expertise. The doctor that is seeing you or is going to take you to theater, you need to know their full history, their credentials have to be above board, and they need to have a good reputation via word of mouth. That is very important. But above that, you need to have a special safety, a special relationship with your surgeon that is going to be with you in theater. The other thing you also need to be very cognizant of is the nurses that will be taking care of you. This is important and this is part of your rights. You need to know who is looking after you. You need to know who has your personal information and how it's going to be used. It's important for you to know who is going to be attending to you within your private space within the hospital. So their names have to be visibly displayed either on a name tag or on a badge. That is important for identification should anything go wrong after they've visited you and attended to you and performed some procedures on you. If something goes wrong, you know exactly the name of the person who was with you during that procedure. The next thing that you need to be cognizant of, and which is very important as well, is you need to know the pros and cons of the procedure. You have the absolute right to get a second opinion. You have the right to ask as many questions as you see fit. As the saying goes, there is no stupid question or there's no silly question out there. It might be that silly question that you are holding inside would be the deciding factor whether you go into theater or not. So please make sure that you are asking the questions. Ask any question that you come across and make sure that you are absolutely satisfied with the answer your surgeon is giving you during your consultation. If not, feel free to go for a second opinion and see what another surgeon has to say within the same caliber. Also, part of the preparation for your elective surgery, you need to follow all the guidelines that are given to you by the doctor and his receptionist or the doctor's rooms. Okay, the doctor has every responsibility to explain everything in detail, including the possible complications, including anything that may hinder your progress or may come up during the procedure while you are not awake and there's nobody else to fend for you at that point. So everything needs to be explained explicitly. And I repeat, explicitly. This is also the time where you would be expected to sign your consent form. to allow you or to give permission to say that you agree to have this procedure done on you. And the most important thing, never sign a consent form that doesn't have the procedure on it. It's important for you to follow all your surgeon's instructions, and they normally have a booklet that you are given before you go into surgery or before you get admitted. If they say that you are a day case, meaning that you will have your surgery in the morning and be discharged in the afternoon, please make sure that whatever time they give you to get to the hospital or to be at the hospital, please give yourself an hour and a half more time. So let's say, for example, the doctor says you can come in at 7. Please do come in at 6 or 5:30 in the morning, so that your reception, your admission process in the reception waiting area is done expeditiously. You get to the ward, you get admitted, you get settled, and you're not rushed and you're not anxious, because anxiety can also cause unwanted complications within your operation while you're under anesthesia. So make sure to get there earlier than what your doctor has instructed you to do. The other thing that you need to be cognizant of is it's very, very important that when you get to the ward and you are being admitted now physically into your bed that you are going to be lying in before you go to theater or you go for your procedure, you have to give a clear and concise and an honest history. You name every medication that you are taking at the moment, because that is also vital to the interaction with the drugs that will be given to you while you're in theater, and also may have an effect on how quickly you recover after the surgery and how soon you'll be discharged to go home. So that is very important. Please disclose everything that you have to the nurse and put it down so that it's on your record, it's in your documents that these are the medications that you are on, and it's written and it's there. It's a record for your safety and your safety alone. The one thing I would like to also emphasize, when you are going for surgery, there is no point in you signing any documents the minute you have left the ward and you are in the theater complex. That is not the ideal time to take consent from you. All these things should have been done prior to you getting to theater. It's like your anesthetist's visit should be done in the ward before you get called for to go to theater. So that is very important. And they will also give you a consent form which you will have to sign, and they need to give you an explanation as to why you are signing. Every time you need a signature, or anytime we need a signature from you, you need to know exactly what your signature is holding, or what you are endorsing, or what you are agreeing to. Hence why it's called a consent form, because you are giving us healthcare workers the chance. You are allowing us to look after you appropriately within your will and within your grant, knowing that you've got full knowledge of what is expected and what you are going to be going through. I don't want to hammer this out anymore, but I have to stress once again, the most important thing is the consent. Your initial consent with your doctor has to be in his rooms without exception, and you need a full explanation, and you need time to grasp and understand exactly what you are signing up for. Okay, as well as your anesthetist, he needs to tell you what are the complications of the medications that you might be getting while you are in theater throughout the duration of your procedure that's being done. So all of those are very important. Please don't just sign. Make sure you understand what you're signing for. It's also very important to follow your surgeon's advice. Whatever they've given you to do, or whatever instructions they've given you prior to you even being admitted, it's something like stopping certain medications 2 or 3 days before you are admitted. It's the night before, what you can eat, what you can't eat, when do you stop eating before you come into the hospital. It's also very important for you to follow whatever medication they give you preemptively, such as maybe it's a bowel prep that they need to do in order for them to perform surgery on you. You need to do all those things, unfortunately, in order for you to have a really speedy recovery, as well as a very consistent and more safe surgery while you are under anesthesia. So please follow all your surgeon's advice, regardless of what they are. No matter how they don't make sense to you, but please do follow their advice. And when you are in doubt, please do not hesitate to phone and ask for clarification before you even get admitted. Lastly, but not the least important, this is actually the most important thing that you can do for yourself, is that if you are in doubt, if you have an inkling within your gut that this is not what you want to do, you have every right to do it even before you get onto that theater table or before they start administering drugs. You can say, I'm not comfortable. Can I go back and rethink it? Nobody can force you to perform an operation unless, of course, it's life-threatening. In that instance, the surgeon now takes precedence over you and to make sure that you survive at the end of the day. But if it's a normal elective surgery that you are going for, you know about, if you can hold back only in the incidents when you are not 100% sure or you feel that you're not ready, your body will tell you that this is the right decision or this is the right thing to do. If you don't feel safe in any which way, you have every opportunity to say, no, I'm not ready, and nobody can hold you against your will. These are the rights that you need to know as a patient or as anybody that is coming into the hospital, that you have a right to a second opinion. You have a right to know exactly what you are going for, what is going to be done, what to expect, what are the possible complications that you will expect. Okay, if there are any complications. Also, what medications are you supposed to stop, or what medications do you need to take before you have the surgery? Another thing that is most important is that everybody that walks into your room or comes and attends to you in your private space within the hospital, meaning in your bed, has to identify themselves fully and completely. If you stayed this long, thank you very much for being with me on this video. I hope you took something away from it. And if you did, and you'd like to share it with somebody, please feel free to share it. If you would like to leave a like, please give this video a massive thumbs up. And with that, I'd like to say, take care, God bless, goodbye.